Now we'll go back to Africa after this scientific session by AACD group, and I will talk about the prevention of microvascular complications in Africa. Actually, in fact, microvascular complications, including retinopathy, nephropathy, and neuropathy, are highly prevalent in Africa, and this may be due to their poor glycemic control and late diagnosis. Not only this, but also, as mentioned before, undiagnosed diabetes and increasing prevalence of prediabetes add to this challenge. Urbanization and rising diabetes rates exacerbate the burden, and limited health access worsen the outcomes, with rural areas disproportionately affected. Here, this is a recent study which just released this month, and it gave an urgent concern about rising diabetes complications in Uganda, and they said they are facing diabetes crisis, and said this study sheds light on growing burden of diabetes, not only diabetes, but mainly the complications that arise from inadequate management, and that they address that many adult patients remain unaware of their diabetes status, and stressing about the improvement in healthcare access, education, and regular screening are vital to decrease this problem. We'll start with retinopathy, and we can see that in spite of the progress in screening for diabetic retinopathy over the last 2 decades, but a mega study called Retinopathy Barometric Study, which was conducted across 41 countries, found considerable deficiencies in education of people with diabetes, professional training, and access to affordable treatment. But I have a good news that in 2025, in IDF 2025, we have a decrease in the number of diabetic retinopathy, comparing in Africa 2019 to 2024. We have decreased in the number of all any diabetes-related retinopathy. Now the rate is around 26, with the sight-threatening only, alhamdulillah, 7%. Again, the proliferative diabetes retinopathy only 1%, but on the other hand, diabetes-related macular edema is 11%. We cannot deny that still diabetic retinopathy is the main cause or the leading cause of blindness in African adults. The prevalence range from 16% in Tanzania to 40% in Nigeria. But again, the screening is rare, with less than 20% of diabetics receiving regular examination. Maybe the barriers include the cost, lack of specialists, and poor awareness. The risk factors for diabetic retinopathy include not only the duration of diabetes and poor glycemic control, but also the comorbid conditions like hypertension, dyslipidemia, anemia, and lack of regular eye examination. We have a good innovations in screening and management of retinopathy, like teleophthalmology, artificial intelligence, as mentioned by Dr. Iman, and community-based programs. Here, this study was in 2013, and they found that the patients are preferring the teleophthalmology than the traditional ophthalmologist-based screening, but we need cost-effectiveness studies to be sure about the effectiveness of this form. Again, another study in 2015, which addressed the Zimbabwe retinopathy telemedicine, found that this utility can help for routine retinal screening for diabetic patients. Actually, still we don't have these innovations in Egypt. Very recently, in 2025, there was a systematic review about the prevalence of diabetic retinopathy in Africa, and they found that the prevalence was still very high, with more than 1 in 4 in individual with diabetes developing retinopathy, and they stressing the comprehensive diabetes management on the glycemic control and comorbid conditions. And they mentioned the ministries of health and policymakers should prioritize and implement targeted strategies to address the identified modifiable risk factors. Prevention strategies may include regular routine screening, effective management of blood glucose and blood pressure, use of teleophthalmology if possible. Patient education is essential. Regarding the neuropathy, maybe the rate of neuropathy is much higher, reaching 46%. The prevalence again varies from West Africa 49.4%, to Central Africa, 35%. But we can see that according to the study, the prevalence ranges in Ethiopia from 1.9% to 53.6%, which needs more epidemiological studies. The risk factors for diabetic neuropathy, again, include not only poor glycemic control, but also hypertension, anemia, high creatinine level, presence of diabetic retinopathy and nephropathy, the age over 40 years, and living alone, and physical inactivity. This study, published in August 2024, and they assessing the peripheral neuropathy in Ethiopia, and they said that healthcare providers should prioritize regular screening and early intervention for individuals at higher risk for peripheral neuropathy, and we should implement community-based support programs for this problem. More recently, in January 2025, this study came from Uganda again, and they said that approximately 1 in 3 of diabetic patients surveyed with diabetes have diabetic neuropathy, and we should have early detection and target prevention. This study, very recent, a few days ago, in June 2025 in Cameroon, they found that the prevalence of all forms of diabetic neuropathy was 86.9%, but 63% with subclinical forms, so suggesting the pure clinical approach might underestimate the true prevalence of diabetic sensory neuropathy, and the prevalence of some forms like pure small fiber neuropathy is very high, which needs more interest. Prevention, again, include maintaining optimal blood glucose level, regular screening, managing comorbid conditions, patients' education, and implementing community-based programs for awareness and screening. So actually, we can summarize the challenge in prevention of microvascular complications into limited access to healthcare facilities, shortage of trained healthcare professionals, lack of awareness about diabetes complications, and financial constraints. And our recommendations may include to integrate diabetic neuropathy and retinopathy screening into our primary healthcare services. We need training for more healthcare professionals about diabetes management, to implement national awareness campaigns, and more investment in affordable screening technology. And thank you.